Good morning, everyone. We are with Alameda County Healthy Homes Program Department. And today our agenda will be a quick introduction of my colleagues. We'll also get into some healthy homes, healthy home principles. We'll have resources at the end where we'll provide some training materials and some free services. We also ask that at the end, we ask that you load all your questions in the chat, and we will have a break in time between, and we'll be able to address all your questions that will be in the chat. So the presenter, it will be me, myself, my colleagues, Morgan, Holdman, and Sony. I'll give you a quick bio about us. Again, I'm Yvette Martin. I am a certified renovator as well as a community outreach worker with Alameda County Healthy Homes Department. I work with the lead hazard prevention as well as the minor home repairs grants program. My job is to make sure I get out there to promote the lead safety in the community through our collaborative community initiatives, apply research, and policy development in order to improve safe and healthy housing. In addition, I also I am extraordinary when it comes to commitment to make a public service. And my next colleague will be Morgan Holdman. Now, Morgan, she has worked in a nonprofit for about 15 years as a case manager. She also has helped individuals, families securing housing. Morgan has done community outreach for 10 years. Most recently, she started working for Alameda County as an eligibility worker. After about a year she left and came to Community Development Agency. That is what we call CDA. She has worked for the Healthy Homes Department for almost 3 years also as a community outreach worker, specifically providing health-related education to parents with lead-poisoned children. And last but not least is Sony Johnson. Sony has worked with Alameda County Healthy Homes Department for 20 years and shares her expertise from case management of lead-exposed children, healthy homes assessment, rapid response investigations and enforcement, public outreach, and more. Her background is city and regional planning with an emphasis in social economic policy from UC Berkeley. So, okay, Alameda County Healthy Homes Department. Our mission is to prevent lead and poisoning and to promote health and safety in the home. We are an initiative multidisciplinary program. We have free services and grants towards healthy homes. We established in 1991 as becoming a national leader in childhood lead poisoning prevention. In 2013, the Alameda County Lead Poisoning Prevention Department changed its name to what we call ACHAD, that's Alameda County Healthy Homes Department. While we continue our critical lead poisoning prevention work, our new name now reflects our expanding work in healthy housing. Our office combines health, environmental, and residential hazard reduction services under one umbrella. We have been in business for 30 years now. Through the efforts of a grassroots organization in Oakland to educate the community about the dangers of lead poisoning to our children, the program provides case management to lead poisoned children. We provide community outreach and education, trainings, lead hazard reduction services, healthy homes intervention, and consultations. We have helped property owners make over $1 million in maintenance and property improvements to reduce safety hazards. So today, our learning objective. Our goal is that today you will be able to identify at least 3 to 5 principles which are it, and we have 7 principles, but at least we want you to be able to remember at least 3 to 5. The 7 principles that today we'll be talking about will be dry, clean, ventilated, pest-free, safe, contaminated-free, and maintenance. We want you to be able to identify potential lead hazards in home environments, be able to name 3 health conditions that may be impacted by housing conditions. We'll describe some simple steps that can be taken to improve housing conditions that may contribute to disease and injury. Simple examples will be such as wiping down your window sills, making sure you wipe it down with wet, nothing dry, and also fixing any leaks or any leaky pipes or any leaks that might be appeared somewhere in the home.
Thank you, Yvette. Good morning, everyone. It is my pleasure to let you know about the essentials of healthy housing today. And I can kind of hear in some of your minds maybe turning, asking, why would I be concerned about the health of my house? So back in the early 1800s, there was a public health nurse by the name of Florence Nightingale who actually made the connection between a person's health or a family's health and the condition of their housing, where they lived, where they spent the majority of their time. Around this time when she made that connection, there was a lot going on at the turn of the century, and they created what's called the sanitary reform movement. And this was to really combat a lot of the infectious diseases that were going on around that time, such as tuberculosis and typhus, things of that nature. And eventually, housing actually became one of the influencers as a determinant of health. And so, things come full circle. And as they were experiencing infectious diseases, we had our own infectious disease that we're still combating. One of the statistics that we have is that children generally spend about 80 to 90% of their time indoors. And after the past 2 years, I think we can bump that figure up quite a bit. And so that being said, the condition of the house where they're spending the majority of their time is really important to make sure that not only is it safe, but it's contributing to the family's health. Next slide, please. So that being said, let's ask the question, what actually is a healthy house? It's really a house that is designed, it's constructed, and it's maintained or rehabbed in a manner that's conducive to the occupant's health. And here in Alameda County, the majority of our houses are already pre-built. And so really it's going to apply to the maintenance and the rehabilitation of any of our homes. Unfortunately, what we're seeing a lot here in Alameda County, where our housing stock, at least 80% of our housing stock is built before 1978, the majority of our homes are considered unhealthy. And what that means is that they're substandard, that they're not properly constructed, the renovations might not be done with permits, they're inadequately maintained, and they really place the residents at serious risk. And then there's actually some statistics that show over 6.2 million homes in the US are considered substandard, are considered unhealthy. And unfortunately, one of the epidemics that we're facing in the Bay Area because of the high housing costs is that affordable housing is now considered substandard, or a lot of our substandard housing is considered affordable. The reason being is because the landlords just aren't keeping up with the maintenance. And so what we want to share is that tenants and clients and just families, they don't have to live in substandard conditions. There's actually laws in place that talk about housing habitability standards. And Aaron from HERA, he'll talk about that at the end of our presentation. Next slide, please. So before we begin, I just kind of want to get an assessment of what people know and what they don't know, just so that, I can get a good flow of how quickly or how fast to go through the presentation. And Morgan, she's going to actually conduct a Zoom poll.
Okay, sorry about that. Which of the following is not one of the 7 principles of healthy home? Dry, clean, ventilated, pest-free, pretty, safe, contaminant-free, maintained. Okay, so it seems unanimous that everyone agreed that one of the principles is not a pretty home. Okay, let's see. Next slide.
All right, so thank you, Morgan. So yeah, I'm a fan of HGTV, and I love making a house look beautiful. It's good for our mental health, but you also want to make sure that it's functional. And so definitely pretty is not one of them, though some of us, want to believe that it is. Yvette was able to share some of the 7 principles of healthy housing at the beginning. And so what I'm going to go a little bit further into is each principle. So the 7 principles is that you want to keep your house dry. You want to make sure that you keep it clean. We want to keep it well ventilated, keep it pest-free, keep it safe, contaminant-free, and well-maintained. If you're able to follow these 7 principles, then you are on your way to ensuring the health and the safety of not only your home, but the occupants inside your home. Next slide, please. So our first principle is keeping it dry. Now, keeping it dry deals with excess moisture in the home. One of the best known forms of excess moisture results in mold. And so some of the health effects that are causes of excess moisture or mold is asthma, allergies, and respiratory illnesses. One of the things to note in regards to mold is that mold is a fungus that grows because of excess moisture. In the state ordinances and housing codes, there is no actual code for mold as a housing habitability standard, but there is one for excess moisture. And mold, again, results from excess moisture being in the house. One of the health facts that a lot of people don't know is that mold is actually an allergen, and certain people may be more allergic to mold versus others. And so just because you have mold in the house does not necessarily mean that you're going to have adverse reactions to it, but the majority of people do. And certain populations, especially with young children or older adults whose respiratory systems are either not fully developed or a little more compromised, they're going to have larger reactions to mold as an allergen. But going back to excess moisture, some of the primary causes of excess moisture in the home is poorly managed rainwater, gutters on the outside that's allowing water to come inside, plumbing leaks. And a lot of times you're not going to see the plumbing leaks visibly from visible pipes. Many times they're behind the walls. And so you might smell the moisture, you might smell the mold, or you might see stains. However, you're not going to see the visible mold. And then also condensation on surfaces. One of the photos in the top right corner shows a window where there's mold accumulated because every morning when the sun starts coming out, that windowsill is wet from the condensation. Whenever condensation will build, whenever the inside temperature is drastically different from the outside temperature, and that difference is going to create that condensation. And then also construction moisture. What construction moisture means is basically the way that the house was constructed. A lot of the homes that are built in the 40s here in the Bay Area, they're made with a lath and plaster, which actually does not allow for insulation. Because there is not insulation, that creates a conduit so that the cold from the outside is coming inside. And so in those situations, there's not a lot we can do. The same with aluminum windows versus double pane windows. The construction of the house actually has a lot to do with the way that condensation and excess moisture can come into the house. Next slide, please. So one of the things that we want to talk about are the different ways that water can actually come into the house. There's water that can come in through the interior. And again, that's going to be seen through leaking pipes or fixtures. And then here in the United States, there's over 9 million homes that have reported interior water leaks. And that's over 8% of all houses in the US. And then also, we want to think about the exterior sources of water leakage. Over 12 million homes in the US have reported exterior water leakage, and that's over 10% of all homes. So it's a pretty big number when we're thinking about all the homes that people live in. A lot of people are dealing with this problem. It's a very, very common problem. When we see exterior water leakages, we look at the roof. We look at basements, especially here in the Bay Area. A lot of homes need to have sump pumps because of some flooding. There's also water intrusion that comes in through the walls on the outside of a house. If there's not rain gutters that prevents the water from the roof from coming down, they can leak into the walls, or if there's roof leaks. And then also through closed windows and doors. So in the picture, I have a photo of I think that's an air conditioning unit. And on the inside, it shows where the water leakage has seeped in. Even though it's a brick building, it has seeped in through the roof and has created mold. Next slide, please.
Okay.
All right. So we got another Zoom poll. Yeah,
Mhm.
Morgan.
Yes, so which of the following is a likely cause of mold in the home? So you'll see four pictures, and just choose the picture you think is most likely to cause mold in the home. So it seems like we have a larger amount of people saying that picture 3 is the likely cause of mold in the home. And then picture 4, picture 2, and then picture 1. Actually, the results are picture 1 is most likely to cause mold in the home, for the simple fact that the roof is leaking, and they apparently tried to tarp the roof, which did not work, and it resulted in the development of mold. And maybe it's kind of hard to see. Picture 2, the draft, I think, would be an issue, but we also have in that picture, you would be able to have pests come through the holes in the walls. It could also be a lead hazard, since bare wood and chipping paint is present. In picture 3, it's kind of hard maybe to see what that is, but it's feces from pests like roaches. And that really wouldn't cause mold. And then also picture 4 is chipping and peeling paint causing lead hazards, which also is not necessarily a cause for mold. So the answer was 1.
All right, thanks, Morgan. So one of the things, the second principle that I want to talk about is keeping your house clean. And that doesn't mean, when I say keep it clean, that we're judging or looking at the occupants, but what that really means is keeping your house free of dust, keeping it free of allergens, because again, we're thinking about the health and safety of the home. Whenever there's dust, especially from pets or just from clutter, or even dust from the outside, it creates a lot of allergens, which can actually lead to health effects such as, again, asthma, allergies, and increased respiratory illnesses. And so the ways that we want to ensure that we can help keep our house clean is we want to reduce harborage from pests. Now, harborage is considered any clutter or garbage that's sitting around the house. And so the bottom left photo shows some clutter or harborage that is in the backyard. That is an ideal place for rats and mice to feel safe because no one's going under there. Another thing that we also want to talk about is how to reduce exposure to this. And so chemical contaminants and pesticides, I'm going to talk about that a little bit. Allergens, so the top right photo is a photo of a dust mite. Dust mites you cannot see. They're very, very small and microscopic. However, they do bite and they feed on skin. And they are brought into the house because they actually catch a ride on people's suitcases, on their pant legs. They are able to come in through a variety of different sources. And so it's very easy to spread because the life of a dust mite, it reproduces really quickly. The other thing is pests. So we have a lot of pests that come into the home, especially the older homes. And so I'll talk a little bit about how we can reduce some of the exposures to pests. Next slide, please. So in order to do it, we want to make sure that we keep the house clean. And there's certain ways that we can actually ensure that we're keeping it clean. The first one is we want to isolate some of the problems. In the last slide, there was a picture of 4 dogs on a person's bed. And so one of the things that you want to try and do is to teach your pets not to climb in the bed with you because they do carry a lot of dander, which is an allergen, as well as if they're indoor and outdoor, they're bringing in a lot of dust from the outside or soil from the outside that is being trapped inside the house. And then also you want to make sure that you reduce any type of clutter or garbage in the home, anything that is edible to prevent rodents and mice and pests from coming in. You want to put them in sealed containers and not have loose food, whether it's dog food, cat food, or human food, such as cereal. You want to put it in an airtight container so that pests don't have access to it. And then any type of garbage, of course, recycling is a great way to do it. Composting, again, so that everything is in a bin and the house is clutter-free. The other thing is cleanable floors. This is a really important aspect of healthy housing, only because carpet, though it does insulate the home and keeps the occupants warmer, if you're going to have carpets, it's probably safer to have area rugs. But what we really advocate for is cleanable hard surface flooring. And so that could be tile, that could be laminate, that could be wood floors, because whenever you wet mop a floor, you're actually weighing down the dust and you're able to remove that dust more efficiently than in carpets. The dust and debris in carpets, they settle down to the bottom and it takes a very long time to get it out, especially if the carpet's been there for years. And then the other thing is that's really going to help is to ask people to take their shoes off before they come inside the house. We don't know where they've been and what they've tracked through. And so what we want to do is prevent that from coming inside. And so just asking people to take their shoes off outside the house, that would prevent a lot of dust and debris from coming inside. And finally, healthy cleaning. What healthy cleaning means is reducing the use of toxins or harsh chemicals when you clean. A lot of times people want that fresh Lysol scent. However, Lysol and even vinegar can be asthma triggers just because of the strong scents. And so what we usually recommend is more natural methods such as hydrogen peroxide. Whenever somebody has a wound on their finger, you pour hydrogen peroxide on it because it's a disinfectant. And so if you still want that clean smell, squeeze some fresh lemons in there and you have an instant household cleaner that is not going to use chemicals or toxins to keep your house clean. The other thing is we really recommend HEPA vacuums. And a HEPA vacuum is basically a high efficiency particulate filter that captures up to 99% of fine dust particles. And so especially for households with asthmatic children, with elders or babies, you want to make sure that you get a vacuum cleaner that has a HEPA filter in it. They're heavily marketed, and the majority of household vacuums do have HEPA filters on them. Next slide, please. All right, the third principle, keeping it ventilated. Some of the possible health effects of poor ventilation could, again, lead to asthma, allergies, respiratory illness, but also things such as airborne viruses. You can have fatigue, coughing, or congestion if the house is too closed up and somebody is sick, or if you have carbon monoxide that is in the house and there's a carbon monoxide leak, that could lead to skin rashes, nervous system damage. And then there's also toxins in the house that can create cancer. And so, you know, we really want to pay attention on the ventilation of the house and the contaminants that might be in the house. Combustion contaminants is an example of one of them. The lower left photo has a gas stove that's used, and actually I think it's a butane stove that's used to heat the house. And this is more on the Midwest. However, a lot of people, because of the cold, they might use electric space heaters are okay, but anything that is a gas appliance or a propane appliance, you do not want to use it indoors unless it's very well ventilated. The other thing that causes issues are heating problems, because people will use their stoves or their ovens to heat their house. If it's a gas appliance, again, we want to deter that from happening. Heating is actually a habitability issue. And so if there is not proper heat in a client's home or in a person's home, then that's a violation of state housing code. But we also want to prevent and discourage the use of any gas appliances that are not set up as heaters specifically. We want to deter the use of that. And then also clogged heating or air conditioning ducts. A lot of times people won't clean them up, and these ducts can accumulate with all kinds of pollutants, toxins, hazards. And so as soon as the heater comes on, all of it gets blown into the house through the vents. And then finally, I'm going to talk a little bit about VOCs. VOCs emit a gas. It's a invisible gas that comes from different products, and these VOC compounds, they're very toxic to people's health. And so we'll talk about some of the VOCs and what we can do about that. Next slide, please. So in order to keep homes ventilated, when it comes to healthy housing, we want to install exhaust fans or make sure that there is an operable window. Here in Alameda County, when we do a lot of our housing inspections, we see windows that are sealed up, especially the older Victorian windows, because they've been painted over thousands of times. If you don't have an operable window in the kitchen or the bathroom, you want to make sure that you can install an exhaust fan in those areas. Kitchens and bathrooms, the reason being is because bathrooms, there's moisture. You need a way to reduce that moisture content in the bathrooms. And then in kitchens, not only is there moisture, but there's also smoke from cooking. And that smoke can also act as an irritant to the occupants. For your heating and air conditioning systems, you always want to make sure that you have a filter. And again, a HEPA filter is going to filter out the majority of any type of dust and allergen particles that come through the ducts. And then also you want to make sure that you're able to get your ducts cleaned periodically. And then finally, carbon monoxide detectors. There was a report of a carbon monoxide death. I believe it was in Pittsburgh earlier this year. And a mother had passed away. She didn't survive. Her 2 children were in the home as well as her husband. They actually survived. However, as we all know, carbon monoxide is colorless and it's odorless. If you have gas appliances, I do believe at this point it is required that every household have at least one carbon monoxide detector, and it is the responsibility of the landlord to provide that. Next slide, please. Oh, keeping it pest free. This is a fun one. Now, this whole presentation about healthy homes is actually a day-long course. And so I'm reducing it a lot just to fit within our time frame. However, keeping it pest-free, the whole idea of pests in the home is a very huge issue, not only because is it so common here in the Bay Area, but also because it's such a nuisance. And so of course, the possible effects of pests in the home are irritations of the skin rashes, upset stomach, nausea from any of the dander or the diseases that a lot of the pests or rodents are carrying, allergies, and of course, respiratory illnesses. Some of the common pests that we see, and pests are different from bugs. So pests are more known to carry diseases with them, and so they are more of a health hazard. So rodents are either mice or rats, cockroaches, and then there's a few other ones such as bed bugs that they get a whole class and presentation on their own. But generally, a lot of the homes here, at least there's been over 900,000 homes that have reported rats in the home, which is at least 1% of all housing in the United States. And then mice, over 6 million people have reported mice. That's over 6% of all homes here in the United States. And then cockroaches. Cockroaches have been a problem, especially in public housing, and over 50% of public housing has reported cockroaches in the home. And then 10% of houses have cockroaches all the time. Some of the hardest housing to get rid of cockroaches are multi-units, apartment buildings, where there's more than one unit attached to the other, because a lot of times pests and cockroaches, they will run from unit to unit. So you can't just get rid of them in one unit and think that they're going to stay without addressing the whole building. Next slide, please. So the best way to get rid of pests is through a process that's called integrated pest management. And it's a whole science on how you can actually identify the pests and get rid of them. And so the basic premise behind it is that you want to take away where they live. Change the surrounding landscape. You want to block any type of entries that they are able to access the home into, and then you want to reduce their hiding places. The top photo is actually an outlet. It's a surge protector, and the pests are actually, the cockroaches are going inside the surge protector to keep warm. So if you think about electricity and warmth and it's always on, that's a key place where they're going to be hiding. The other thing is you want to reduce their food availability, reduce any type of garbage that's around, food scraps that are falling on the floor. Something that people don't think about is left out pet food from dogs and cats. So crumbs are ideal. And then also in your kitchen, when the grease splatters and it's on your backsplash, or it falls between your stove, or there's food from the refrigerator that's coming down, that's what they love to feast on. And so also any dirty dishes in the sink, it's key to make sure that dishes are washed or at least placed in the dishwasher before you go to bed. Because as everybody knows, the pests love coming out at night and they're nocturnal. And then finally, one of the key points is to try and knock down the population. Now, when it comes to traps, we generally put out sticky traps at the beginning just to get an idea of how serious the bug problem is. If you put down a sticky trap and the next morning it's filled with bugs that got caught on it, that means you have an infestation. And so we're going to have to use different tactics to deal with the infestation versus you might get 1 or 2 cockroaches after having the trap out for 3 days. The problem isn't as bad, and so we don't have to take as harsh steps. And then if it is an infestation, you might have to use pesticides. However, that's always going to be the last resort. And that's to knock down the population so they're not breeding as quickly as they can. Next slide, please. So when we think about pests and getting rid of pests, we want to think about this triangle, because every pest, which is an animal, needs 3 things in order to live. That's water, food, and a place to hide or rest. If we can take these 3 things away from the pest, there's absolutely no reason why they will stay in your home. And so these are the 3 key things that we focus on when it comes to integrated pest management. If you come in and hire an exterminator to kill all the existing pests, but you still have food there, if you still have a water leak, if you still have a lot of garbage and clutter standing around the house, they're going to come back. It's not a permanent solution. And so when it comes to integrated pest management, again, we want to be able to reduce the clutter. We want to be able to keep the house and the floors clean, wet mop. And then also we want to use the HEPA vacuum to get rid of the dust. But also there's best practices in regards to getting rid of pests. So pests want a place that's warm, and we're going to get rid of that. We're going to get rid of their water, food, and the harborage. And then again, we want to use only pesticides as necessary to knock down the initial population. Next slide, please. And possibly if people are interested in learning more about the different principles, we might be able to set up more of a training, which might be either a full day or a half a day. But again, I'm just giving you the essentials of everything so that you can learn more about it. So the next principle is to keep it safe. And the most common cause of injury deaths in the home are related to poisonings, which is 62%, falls of the occupants, which is 25%, choking and suffocations, fires and burns, drownings, firearms, and then 5% are from other sources. And so one of the things to know is that preventable injury deaths have increased tenfold since 1980. So that's in 30 years, they have increased tenfold in every single area. And when it comes to the ages or the populations that are most susceptible, when it comes to falls, it's generally for children between the ages of birth to 14 years old, as well as older adults. And so seniors, they're more susceptible to falls, just like young children are. The highest rate of injury death for 1 to 14-year-olds is fires and burns. And then for infants, the highest rate of injury death is through choking and suffocation. And then also adults 80 years old and older, they're actually 20 times higher at risk for dying from an injury in the home as a younger person would be. Next slide, please. So how can we keep our homes safe so that there aren't these injuries and falls? One of the things that we want to do is, well, one of the ways that people fall is through holes or trips on the rug. but the rug is bunched up or the flooring is not intact. Also, we see a lot of electrical wiring problems where the wires are hanging out, and or the faceplate is broken. And then, of course, there's over 60% of homes that don't have a working smoke alarm or carbon monoxide detector. Just because you have one in, you want to be able to test it at least twice a year to make sure that the battery is still good and to make sure that it's still working. And so when it comes to holes in the house, there's over 1% of all homes have holes in it to where people can trip and fall. And then, especially for households that are in poverty, that number doubles. And so it's because of the maintenance of the home. And so later we're going to talk about the maintenance of the home. Electrical wiring, exposure to electrical wiring, that leads to shocks and burns. And then again, we just want to make sure, and it's the responsibility of the landlord or of the owner to provide smoke alarms in every home, as well as carbon monoxide detectors. Next slide, please. So how do we keep our homes safe? One of the things that we want to do is make sure that we read product labels to see what's toxic and what's not toxic to the occupants. And then the toxic items, we need to keep them out of reach of children, whether that means up high in a cabinet, such as if we have pills and medicines, keep it somewhere where the children can't get to them. So up in a high cabinet, or if it's going to be in a lower cabinet, such as under the sink where we might have bleach, you want to make sure that you use child safety locks on the cabinets so that they can't actually access it. The other thing is temperature guidances. So we have a lot of injuries that are caused in the home because of burns through hot water, because the water heater is set too high. You want to make sure that you read the guidances and set the temperatures appropriately, not only for the water heater, but also for your refrigerator and your freezer to prevent any type of food contamination, because the fridge and the freezer are not cold enough to kill any type of viruses and bacteria. Again, I can't emphasize installing and checking smoke alarms and carbon monoxide detectors, making sure that the batteries are working and that there is one in every bedroom, as well as the common space areas. And then also one on every floor if it's a multi-unit floored house. And then also repairs, if there's any type of holes or broken face plates, you want to make sure that you can address those or reduce access immediately. Especially if you have smaller children, they love putting their little fingers in little spaces. And so outlet covers are also a good thing to utilize, as well as door handles. If for some reason some of your clients don't have these items, you can give us a call at Healthy Homes, and we actually have access to products that we can get through Children's Hospital Oakland, such as the cabinet locks or the door safety handles or the outlet covers. Next slide, please. Keep it contaminant free. So this one actually talks a little bit about some of the contaminants that you might deal with that you need to use, or that you think you need to use to keep your house clean, to keep it pest free. But when it comes to being contaminant free, we're talking about a large array of different contaminants, such as lead-based paint, such as environmental tobacco smoke, radon. There are a number of houses, and radon is actually a geographical gas that comes out of the ground and into the homes. And then also different biologicals, there's combustion products that are in the home. A lot of them do have VOCs or aerosols. And then pesticides. So pesticides are only used in the home or in the garden as necessary. And then asbestos, because the majority of our housing stock, again, 80% is built before 1978, we're going to be seeing some asbestos in the home. We talked about VOCs, but I'll talk about it a little bit more, and then also sewer gases. So these are some of the main concerns that we see in the Healthy Homes programs when we're doing home assessments that are related to contaminants. Next slide, please. So what can we do in order to make sure that our homes are contaminant free? Some of the key ones that we deal with a lot is, of course, lead poisoning. As Yvette had mentioned, we initially started off 30 years ago as lead poisoning prevention program. And so the main thing you want to do is, because you cannot tell if a child is lead poisoned just by looking at them, you want to make sure that your child is getting tested with a blood test for lead when they're 1 and 2 years of age. And then also, if they've never been tested at least one time before they turn 6 years old, especially if you live in an older house that was built before 1978, which again is the majority of our housing stock, or if there's somebody in your household that works in a lead-related profession, such as painting, construction, gardening, or recycling, or as an auto mechanic. The other thing is asbestos. Asbestos and lead are very similar, and they were used around the same times. Asbestos, when it's broken or when it's disturbed, the fibers are airborne, and they can get into your lungs, and they actually cut your lungs up. And so it's really dangerous. If you think or suspect that you have asbestos, in the areas where they use asbestos heavily in older homes is the floor tiles. Usually it's going to be an 8x8 size floor tile. If it's larger than that, it's probably not going to be asbestos, but that's kind of one of the key identifiers that you can use to identify asbestos tiles. Around the ducts or the heaters, they may have used an asbestos insulation. Popcorn ceilings are very well known to have asbestos because it was used as an acoustic. However, houses that were built more in the 70s, the later 70s, the likelihood that popcorn ceilings have asbestos is fairly low. But if we're looking at housing that's built in the 40s, the chances are a lot higher. If you suspect asbestos, the main thing you want to do is don't touch it. If it's an area that you are rehabbing, or if it's an area where there is some type of deterioration or damage, you want to get it tested and then hire a professional to remove it, because they will need to take certain precautions, not only to protect your home, but to protect the occupants and themselves. Tobacco smoke is a big one. And so with tobacco smoke, we want to be able to prevent not only secondhand smoke, but third-hand smoke. Third-hand smoke, for people that don't know what that is smoke that might get on your clothing because you were exposed to secondhand smoke. And so when it gets on your clothing, it gets in your hair, that's an additional exposure that people have. And then the main thing that we want to do is to encourage those that are smoking to try and join cessation classes, which there are a lot of free ones that Alameda County provides. And if for some reason they don't want to stop smoking, we really want to encourage them to not smoke indoors or around children. They need to smoke outside, at least I think 10 feet away from a building and in a very well ventilated area that's outdoors. And then finally, when it comes to VOCs are volatile organic compounds, and we want to avoid the use of these. And so there's a lot of off-gassing that happens with newer products, such as paints. When you paint a house, that new paint smell is not a good new paint smell. It's not like a new car smell. So you want to make sure that the windows are open and that it's well ventilated. However, now they do provide either lower VOC or no VOC products. And those are the ones that you want to keep an eye out for. Next slide, please. Okay, we're coming down to the end, keeping it maintained. So this is actually the last principle, and I think we're doing really good on time. What After talking about everything and you've gotten your house to a point where it's clean, where it's pest free, where it's moisture free, the next thing you want to do is maintain it in that condition so that it doesn't start to deteriorate and you can continue to have a healthy and clean home. And the best way to do that is inspect it. Now, we do have some checklists that you can download, and I'll make sure that Leah can get some to email out to all the participants. And some of the easiest ways to inspect the house is do it by season. And that's basically every 3 months. So we have spring, summer, fall, and winter. At the beginning of each season, there are certain things that are specific to that season. So prior to winter, when the fall starts coming, you want to check to make sure that there are no roof leaks or anything from the exterior, from the elements are not going to come inside and, actually create moisture intrusion, leaks, or mold. You also want to ensure that you keep certain areas clean, such as the ducts. You don't have to clean them weekly or monthly, but seasonally, you want to make sure you clean it before the spring season when allergies are coming. You want to keep certain areas lubricated just to make sure that the components are working correctly to prevent injuries. And then also replace anything that is broken that cannot be repaired. And then you also want to make sure that you organize your house. The more you're able to organize it, you can reduce the harborage, you can have safe, natural cleaning products that are available. And so we can set up a plan on how to keep your home as healthy as possible from the beginning, and then how to also maintain it in that safe way. Let's see, next slide, please.
Okay, so now we have our last Zoom poll. Please name 2 health conditions impacted by housing. They are asthma, lead poisoning, falls, burns, allergies, and lung cancer. Okay, so actually, if you chose any 2 of the following that we listed, you would have been correct. All of the ones that are listed are can cause health-related issues in the home. And yeah, so thank you for your answers on that.
Sony, before we go to the next slide, we have a question in the chat.
Yeah, let's take some questions.
One of the questions I see is, what are the best ways to lower moisture in a home?
That's a very good question. And so depending on the home, there's different ways that moisture comes into the home. Some are occupant related and some are housing related. So the occupant related ones, if there's too many people inside a house because of the housing crisis that we have, we see a lot of homes that might have 2 and 3 families sharing a household. We might see 4 or more people in a bedroom. And so the more people there are that are in the house, it's going to increase the moisture just because of the breath that's being breathed. So we want to make sure that if there's no way to get around a house with a lot of people, you want to make sure that you open the windows for air circulation, have fans available to circulate the air around so that it's not settling in one area. Open windows in kitchens and bathrooms, and then any type of furniture that's in the house, especially if it's facing an exterior wall, you want to make sure that it's not right up against that wall, because that furniture, especially beds or dressers or curtains, are likely to get mold because of the condensation or the difference in heat between the outside and the inside. And again, a lot of this is construction related with the older homes that are lath and plaster. One of the photos that we had, it showed the crack in the wall and you can just see the wood boards. There's no insulation in there. And so when there's no insulation between the outside and the inside of the home, you're not going to get that barrier to keep the house as warm as it should be. And then also in closets, a lot of people want to keep their closets closed. There's very few closets that might have windows in it. And so every now and then you want to open your closet to ventilate it so that there isn't moisture that's accumulating in the closet. There's some moisture, oh gosh, it's like this thing that you can put in your closet that will capture the moisture. That helps. And then also dehumidifiers. Certain houses, if you have a lot of people in the house, to reduce the moisture levels, you can use a dehumidifier, which will actually remove moisture out of the air. And so those are some of the ones that we see that are pretty common here in Alameda County. Was there, oh, you're muted.
Follow-up part 2 of the first question is, what is high moisture in the Bay Area? My home hovers around 60 and 70. Is that high?
That's a good question. And I actually don't have that statistic, but you know what? If you can get her name and number, I can get that information for her and send it out. And if other people are interested, when we send out the resource information, I can give everyone Bay Area specific numbers.
Okay. Okay, that's great. He'll reach out to you.
All right.
He said, great, he'll reach out to you, Sonny.
That sounds great. Morgan, do you want to continue with the next slide?
Yes, next slide. Let's see. Okay, so what we have available: free services, free property consultations, free training and classes, free grant money to help repair hazards. The next slide will show you more specifically our lead hazard control grants. Grants up to $10,000 for lead hazard repairs for properties built before 1978. Family must be low income. Additional funds for other safety and housing issues. Free lead risk assessment testing and free clearance testing is our lead hazard control grant. The next slide is our website. Join us and stay on top of the excitement. Go to our website, follow us on social media, sign up for our e-subscribe. Here is also where you would be able to fill out the pre-application for the lead hazard control grant. Next slide. Our contact information. Oh, I'm sorry. Our contact information: my name Morgan, Holdman, Yvette Martin, Sony Johnson, Alameda County Healthy Homes Department. Our website, www.achhd.org. And I guess, are we going to open it for more questions?
That sounds great. While we're waiting for questions to come in, because I know Erin has a portion after us, I just really want to plug the grants that we have. We can spend up to $10,000 per property. Because we're coming out of COVID, we still have grants available. And I encourage anyone to apply. If your clients, or if you know anybody, your neighbor, your grandmother, your aunt that has an older home and is considered low income. In the Bay Area, low income is $90,000 for a family of 4. If you make under that number, and this is the income of the occupants, if they make under that amount, then they qualify for this grant. This is grant money that does not have to be paid back. We can use up to $10,000 to fix the interior, the exterior of the home if there's lead hazards. And then we also have another I think up to $500 to deal with some of these healthy homes issues. Some of the things that we've done in people's homes is rip up the carpet and install vinyl wood planks that, look like hardwood flooring, but they're vinyl, they're easy to clean, and they're insulated. We've also installed water heaters. We've installed safety rails. We've installed lights outside to make sure that it's not dark and people aren't tripping when they come inside the home. So there's a lot of different ways that we can actually utilize some of these healthy homes funds to help make the house safe. So if you know anybody, please have them go to our website and apply for the funds. There's absolutely no obligation if you just apply and you want to get some more information on it. Also, I want to encourage everybody to either like us on social media and subscribe to our e-subscription page, because that's when you'll find out when we have trainings, we have free classes. If you're interested in a presentation, our staff can either do a Zoom presentation or we can come out to your facility and offer a staff presentation, parent presentations, or presentations to any of your clients.
I maintained the chat as you were presenting. So I think we've answered all the questions that was in the chat so far.
All right, sounds good. Leah, I'll hand it back to you.
Oh, great. Actually, you know what? If you don't mind answering some of the questions that were in the chat so that they get recorded by the video, would that be okay?
Yeah.
Okay, great. Let's go back to somebody asked, what is HVAC? And what was the other question?
And the HEPA.
Yeah.
Yeah. So let's go back.
So an HVAC system is considered the heating and air conditioning system that's in a home. A lot of the systems out here don't have air conditioning, but that's okay, because if you have a centralized heating system where you have the ducts that push air, or it's forced air that goes to every room versus a wall heater or a space heater, then the ones with the duct systems are considered HVAC systems. So again, it's for heating and air conditioning, or heating or air conditioning. And then, Yvette had mentioned that HEPA is high efficiency particulates. It filters out at least 99% of fine dust particles. And so when it comes to filtration and making sure that it's reducing allergens, anything that says HEPA is the way to go, whether it's a filter for your heating system, for your duct system, or for your vacuum cleaner. The key word is when you see HEPA, that's what you want to definitely get.
Awesome. And then another question was, what is radon and is it common in the Bay Area?
So there's certain geographical areas in the Bay that are more prone to radon. So radon is a natural gas that comes out of the ground, and it goes into the crawl spaces, especially if there's crawl spaces that are uncovered. If there's just dirt and there's no containment under that ground space, then those vapors of the radon vapors can actually come in through the house. And so there are radon detectors. If you are interested, you can give us a call. I think we have a few kits that we can send to you. But again, there's certain areas like Albany that is more prone to having radon under the ground. And so Oakland is not known for radon. Usually the areas that are, I don't know what causes certain areas to be more prone to radon, but I know the areas in Alameda County that that radon has been detected.
We can, we'll share that to everybody when we send the resources, in case you live in that area. So if you have like a concrete slab house, then that's not as likely to be a danger for radon as a house that's built up with the under crawl space.
Exactly.
Got it. I think that might be all the questions that we had in the chat. Does that sound right to you guys?
Yes.
Awesome.
So far. Yeah.
Okay, fantastic. Well, thank you guys so much, Sony, Yvette, and Morgan. Really appreciate this. We're going to go ahead and have our second speaker, or second presentation, which is Aaron from Housing and Economic Rights Advocates. And I'll go ahead and hand it over to him.
Hi, good morning, everyone. My name's Aaron Ash. Thank you so much for that great presentation. It was so much good information and resources that definitely going to use personally and spread to our clients. So I really appreciate it. Although my cat wasn't too happy about the no pets on the bed recommendation, but that's okay. As I said, my name's Aaron Ash. I'm a staff attorney at Housing and Economic Rights Advocates, and we're Oakland based, but we're a statewide nonprofit legal aid organization and advocacy organization. And it's our mission to serve the most vulnerable communities in California. And we cover a range of issues from all aspects of household concerns and financial concerns for low and moderate income people. So before, I've been at HERA for about 6 months, and before joining HERA, I was in private practice, and before that, in law school, I was a chef in San Francisco actually, and I'm a tenant myself. So a lot of these issues and advice apply to me and probably a lot of you as well. So under California law, as a tenant, regardless of how much your rent is or how your rent is being paid, you have the right to live in a safe and healthy home. And what this means is the law protects tenants who live in poorly maintained homes. So in this presentation, I'm really going to give an overview of how to identify some potentially illegal health and safety issues on your home, and then how to go about getting them fixed by your landlord if you're a tenant. Because it's kind of a short presentation, I won't be able to go over every single potential issue or all the laws. But there will be some time for questions on the end. So if you just put those questions in the chat, I will be able to cover them at the end. And then I won't be able to answer specific personal questions, but I will also provide our information at the end. And I really encourage you to reach out to HERA and make an appointment with us, with one of our other great attorneys or myself, or one of the other organizations that I list at the end that helps with these issues. So what does habitability mean? The warranty of habitability is implied in every rental agreement in California. And what that means is the rental property has to be fit for human habitation. And it begins at the beginning of the tenancy when you move in, and it continues for the entire time that you're living there. Now, a lot of the requirements are outlined in Civil Code section 1941.1. So that's a good resource to go to, and I'll be going over some of the requirements of that, but that's a really great resource. And like I said, it's implied. So whether or not your lease says that these things are required, it is implied in the lease. So generally, what a habitable unit means is it's one that's fit for human occupation and substantially complies with state and local building safety and health codes. And some of the main things it covers are your landlord's required to provide effective waterproofing and weather protection, working plumbing and gas facilities, adequate water supply, adequate and working heating, working electrical systems, clean and sanitary premises. And, that means common areas that are under the landlord's control, and also the unit in general when you move in has to be clean and sanitary as well. Appropriate receptacles for waste and garbage bins, well-maintained floors and stairs that could be a safety or health hazard, deadbolt locks on certain doors and windows. And then, as was covered extensively in the previous presentation, no lead paint hazards. So what this means is a unit doesn't necessarily have to be in like a perfect condition. So like minor repairs or things that may be unattractive don't necessarily violate habitability standards. A unit is really substandard when the conditions are so poor that it affects the health and the safety of the tenants. So under California law, both landlords and tenants actually have obligations to maintain habitability. And landlords, first and foremost, are responsible for repairing and maintaining the units in a habitable condition. So that means they have to adhere to not only Civil Code section 1941.1, which I outlined before and lists a bunch of requirements, but also Health and Safety Code, these sections here that are listed, and just in general, any conditions that endanger the health and safety and welfare of the occupants. So some other requirements that are, specifically enumerated in the Health and Safety Code are bathroom facilities that are working. That includes working toilet, a shower or a bathtub, and ventilation in those rooms, a kitchen sink, hot and cold running water, adequate heating, operating ventilation equipment for bathrooms and kitchens, as I mentioned. There are some requirements regarding natural light in bedrooms, required electrical lighting, visible mold, and then also dampness in rooms. And really, depending on how bad these habitability problems are, a landlord may actually be required to relocate a tenant temporarily, and that could be paying for hotel costs while the unit is being repaired, or relocating the tenant into a similar unit for the time being while the repairs are being made. So as I mentioned, tenants also have a duty to maintain their units and promptly notify the landlord if there is a need for repair. So the landlord isn't responsible to make repairs to the unit if the tenant substantially contributes to that condition. So that meaning if the tenant has created the issue and it's substantially their fault, then the landlord may not be required to fix that issue. And it's really dependent on the circumstances. So as with any of these issues, and I'll mention this multiple times, for specific issues, it's really important to reach out to an attorney to figure out what kind of the best course is to deal with that. So some of the tenant obligations under the Civil Code they're responsible for just taking general care of their units, and that includes common areas, hallways, and outside areas, taking out the trash regularly, using the rooms for the purposes that they're intended to be used, and not really seriously damaging the property. Similarly, you can't remove any part of the structure, and that includes, equipment that's attached to the property or that is there as part of the rental. And also, you're required to use and operate all plumbing fixtures, so the toilets, the sinks, showers, and also electrical and gas equipment. You're required to use that properly. And any damage that is a result of your neglect as a tenant or abuse, or anyone else who's a visitor of yours or your pets, you are also required to repair that. And additionally, if there is a repair that needs to be made, but somehow the tenant interferes or prevents the landlord from fixing it, then the landlord isn't required to repair it in that case if they're prevented from repairing it. So a lot of times when there's issues in apartments, tenants really don't want to complain about the issues to the landlord because they're afraid of some kind of retaliation, whether it be harassment, shutting off or reducing utilities, eviction. We've seen so many different circumstances of tenants just being scared to ask their landlord to fix stuff because the landlord tells them, oh, just move out if you don't want to deal with it. But the reality is, under California Civil Code section 1942.5, it's illegal for a landlord to retaliate against a tenant who makes a request for repairs. And really the best way to protect yourself from this potential retaliation from your landlord is to keep comprehensive records of not only the problems in your unit, but also your communications with the landlord. So what that means is taking really detailed notes of all the communications with your landlord and making sure it's time stamped. So the best way to do that is, email, text, but we recommend always sending certified mail as well. In addition to texts or emails or verbal communications, just and keeping those records for yourself, just so you have a clear record of the communications showing that you were asking for these repairs. If you're using a repair request portal, some large apartment buildings have just an online portal where you can submit a repair request. In that case, make sure that you save your request as a PDF if it comes up, or even if you have to screenshot the web page if you aren't able to save the PDF. That's also very important, just to creating this record of documents that you're asking for the repairs. Also taking pictures of the problems and videos if you have to, if it's a leak or something like that. That's also very important, just to show that the problem existed and that it was serious and that you contacted the landlord. Now, additionally, keeping contact information from different witnesses, such as friends, neighbors, repairmen who come and tell you that this is actually an issue, and also any receipts for things that you personally bought for the repairs, and especially receipts. And when it comes to mold and lead and a lot of the issues that were talked about earlier, keeping healthcare receipts of going to the doctor, whether it's asthma or whatever the health problem is, if it was affected by the conditions, keeping those receipts and the records of going to the doctor is also very important. And the reason keeping these good records is important is not only to prevent the retaliation from your landlord, but it could also assist you later on if you decide that you have to take legal action to get these fixed, if some of the remedies that I'm going to outline in this presentation don't work for you. So the law doesn't require, or the law doesn't require you to make these requests in writing. So if you make verbal requests, the landlord is still required to respond to verbal requests, but that just makes it way more difficult for you to prove that you made the request if you're just saying it verbally. But in the circumstance that you do make a verbal request, we recommend that you write down exactly what you said and write down the date and time, and then also follow up that request with certified mail and an email or a text, as I mentioned before. And I really can't emphasize enough to put everything in writing, document everything, and just create this record of what the issues are in your unit. So next, how do you request repairs? After you've documented the repairs, and it's not some minor thing that you created or that you can fix on your own, we recommend writing a formal repair request letter to the landlord. And in this letter, it'll specifically explain the issues and letting them know the time and date that you contacted them about the issue, and make sure, we recommend sending it certified mail. And when you send it, sign it and make a copy of that and keep it for your own records as well. And same with anything else, just keep plenty of copies so you have that record. And like I said, send the letter via certified mail. And what we also recommend is have it require no signature, so it definitely gets delivered, but put tracking on it so you can actually go on and confirm and have proof that it was delivered to your landlord. And if there's a property manager who is an agent of your landlord that you mostly deal with, we recommend to send it to both the landlord and the property manager and keep copies of both of those. And if you don't get a response, which often happens, we recommend you following up with your landlord and basically repeating these steps, making sure there's always a time and a date on it, and making sure you're always keeping the records. And if you still don't receive a response, we recommend to reach out to a lawyer, and they can give you help asserting your rights. But right now I'm going to go over some other alternative options that you can discuss with your attorney if your landlord doesn't repair the issues or they don't respond to your multiple requests for issues. So the first thing we recommend is that you request an inspection. So in a lot of municipalities or counties, this means calling your city inspection agency, whether it's code enforcement or some cities have an administrative citation process. But either way, you call your city's inspection agency to report the problem in your unit and request an official inspection. You can also hire an independent inspector, but it's best really to get it from the city in these situations. And when the inspector comes to your home, make sure you point out all of the problems and ask for a copy of the official inspection report. And if it's made from a city agency like code enforcement or something, make sure they won't have the report right away. So make sure you ask them how you can get a copy of the report for your records, because they won't always send it to the tenant. And usually what happens in these situations, and the reason to put in a request for an inspection with code enforcement, is they'll come out, and if they see that an issue does exist, they'll issue a citation to the landlord and require them to fix the issue within a certain amount of days, or they'll get a fine. So this really puts pressure on the landlord to fix the issue. And it also creates more documentation of the issue, and the fact that you're making an effort to fix it, and for future legal claims or to prevent retaliation, like I said. So now another option to take if your landlord is failing to repair the issues that are going on and you've requested it, is called a method called repair and deduct. Now, I want to caution with this method and a couple of the other methods that I'm going to outline after this, they're very risky and limited options. So it's really important to consult an attorney before taking action on any of these options. And so what repair and deduct is tenants can actually deduct money from the rent after making repairs to defects in the rental unit on their own accord. So, but however, tenants have to notify the landlord via writing that they plan to repair the issues themselves and deduct, and they have to wait a reasonable time before actually making those repairs and deducting the rent. Now, a reasonable time has been seen to be around like 30 days. Sometimes it can actually be shorter in case of emergencies like a broken toilet or something like that. But like I said, this is a very risky option because the landlord can begin eviction proceedings saying that you didn't pay them rent, and or they can, kind of dispute that the habitability issue even exists. So that's why it's really important to talk to an attorney first before you take this action, and really important to keep all records and receipts, and also when you're getting the issue fixed, to have a licensed professional come and fix it rather than just fixing it yourself and then trying to get compensated or reduce rent for your actual labor. So the next option that we recommend is, if your landlord isn't responding to your repair requests, is you can take them to small claims court. And tenants can file a lawsuit against the landlord to recover damages, or even get a repair order from the small claims court telling the landlord that they have to repair the issue. Now, lawsuits in small claims court, they have a limit of up to $10,000 in damages. And this is also a risky option because tenants have to pay court fees up front, and the landlord ultimately could countersue and claim that the damages are the tenant's fault or something like that. So again, it's really important to consult an attorney before taking action in this method. And if you were to win a lawsuit in small claims court for damages, the potential damages you could recover are rent rebate to compensate you for paying rent on a substandard unit, damage to your personal property that maybe resulted from some of the bad conditions, or even health issues caused by the conditions, and potentially cost to relocate or stay in a motel, like I mentioned before. So the next option, and this is kind of an even more extreme option, and again, very risky and limited, is a tenant can withhold or stop paying rent, some or all of the rent, if the landlord fails to fix really serious defects that violate the warranty of habitability. And for this method, the defects really have to be considered substantial and pose a serious risk to the health and safety of the tenant. And there's no law saying how much should be withheld, but it's usually a percentage of the rent, and that's just really hard to determine. So that's why we recommend really talking to an attorney before you take this action. And additionally, you have to notify your landlord in writing and provide documentation to them prior to taking this action. And same for some of the other options like small claim court and the repair and deduct. The risk is the landlord could start an eviction proceeding for non-payment of rent, and they could they could say that the issues were your fault, and then it comes down to you proving it. And that's where, again, all this documentation that I've been talking about really is important. So another option is constructive eviction, or abandonment, it's called. And this is when the rental unit is so bad and the habitability conditions are so bad that it affects a tenant's health and safety to the point where they just have to move out immediately. In this case, again, it's very risky because the landlord can say that you broke the lease. They can sue you for rent and damages. And sometimes the health and safety issues might not be bad enough to justify this remedy. So again, consulting an attorney if you're going to take any of these options is really important, and notifying the landlord that you're going to take this action as well is really important. Okay, so that's the end of the presentation. And as I mentioned, we're a nonprofit legal aid organization, sorry. And we give free legal services to low and moderate income Californians. We cover a wide range of issues. We do charge on a sliding scale for estate planning, but all of our other services, which are on the next slide, are free of charge. And here are some other nonprofits that are really great in the Bay Area that also help with tenants issues. And at HERA, we don't provide eviction defense services. So if someone's served with an unlawful detainer, we recommend going to one of these other organizations to help with that. And here's just a brief list of the services that we provide. And if you want to find out more information or reach out to us, our telephone number is here at the bottom, and also our website. So now I'll open it up to some questions.
So I had one question, which is, I text my landlord and they text me back. That's generally, the fastest, easiest way. Would screenshots of text messages count as, like proof that you contacted your landlord about an issue?
Yes, yeah, that's good. Text screenshots of the text message, if it shows the time and date, again, that's really important, having the time and date. And if there is a way for you to somehow download the transcript of the text, it might be different for different carriers. So you actually have that official timestamp is also helpful. And then again, like I said, when you text your landlord and make a request, it is really good just to follow that up with a letter, certified mail, and make a copy of that letter, because that really is the most reliable way. But yeah, it's a screenshot of a text, if it has the time and date on it, usually is sufficient, and it's better than a verbal request.
Awesome. Okay. Does anybody have any questions for Aaron? We'll go ahead and leave that chat open for a little bit. Oh, I did have a random question. So if, let's say your refrigerator breaks, or your toilet, and it's the only toilet in your house, isn't functional, you might have covered this too. I apologize if you already said, how long do they have to respond or send somebody out to fix the issue?
So it's a reasonable amount of time is what the law says, and that's not really defined, but depending on how bad the issue is and how it affects the health and safety, that that can change. So in that instance where it's the only toilet or the only refrigerator, I would say that time is probably shortened to a matter of days or whatever. If it's something that that isn't as essential or doesn't have as big of an effect, it could be up to 30 days or something like that. So it really depends on kind of how severe it is and how directly it affects the tenant's health and safety.
Awesome. Okay, I see Anna has a question, It's, is there a recommended time frame for communications with landlords via mail, like between the first and second follow-up letters?
There's not really a recommended time frame, but I would say, similar to my last answer, it really depends on how severe the issue is. So, if your only toilet is broken, or if there's a flood that's moving to different parts of the house, then it would make sense to follow up immediately the next day, I would say. Whereas if it's something less severe, maybe a few days or a week. So it really, I would say, depends on how much that issue is affecting your health and safety. Because if it is extreme, then I think it makes sense to keep following up until they address it.
Great, thank you. Okay, guys, anything else before we wrap up? This is your chance to ask any more questions of any of the presenters. Okay, then it looks like that's it for us today. I want to thank all of our presenters for sharing such great information. Really, really appreciate you. I want to remind everyone to fill out your evaluation when you receive it later today. And I will be posting a recording of this video along with links to resources and other things that we said we would follow up on, and in an email soon. Okay, great. Thank you so much, everyone.